From time to time, nearly everyone experiences pain or discomfort in the head, scalp, or neck, commonly known as a headache. Most headaches are not serious and can be remedied by lifestyle changes, relaxation techniques, and occasional use of medications. Some headaches, however, may be a symptom of a more serious condition. Headaches have several common causes. Tension headaches occur when muscles contract and become tight in your shoulders, neck, scalp, and jaw. They are often associated with stress, depression, or anxiety. You may become more susceptible to tension headaches if you're overworked, not getting enough sleep, missing meals, or using alcohol or street drugs. Certain foods may also trigger these types of headaches, such as chocolate, cheese, and monosodium glutamate, or MSG. If you drink caffeinated beverages regularly, you may experience a headache when you go without caffeine. Other common causes of tension headaches include holding your head in one position for a long time, overexertion, poor sleep position, and clenching or grinding your teeth. Tension headaches often start at the back of your head and spread to both sides of your head. The pain may feel dull or squeezing, like a tight band or vise. Your shoulders, neck, or jaw may feel tight and sore. Migraine headaches are severe recurring headaches and may be preceded by or accompanied by other symptoms like visual disturbances or nausea. Migraines tend to begin on one side of the head, but may spread to both sides. Migraine sufferers often report throbbing, pounding, or pulsating pain. About 11 out of 100 people get migraines. They may run in families and occur more often in women than men. Cluster headaches are far less common. If you have a cluster headache, you may experience sharp, extreme pain that tends to occur several times per day for months and then disappear for a similar period. Sinus headaches cause pain in the front of your head and face. They are caused by inflamed sinus passages behind the cheeks, nose, and eyes. Sinus headaches may feel worse when you bend forward and when you first wake up in the morning, and are often accompanied by post-nasal drip, sore throat, and nasal discharge. Headaches can also occur in conjunction with a cold, flu, fever, or with premenstrual syndrome. If you are over 50 and are experiencing headaches for the first time, it is possible that you could have a blood vessel condition called temporal arteritis. Symptoms include impaired vision and pain that's aggravated by chewing. Since blindness can result from this condition, your doctor must treat it right away. Headaches can be caused by more rare and serious conditions as well, such as a brain aneurysm, brain tumor, stroke, or brain infection, such as meningitis or encephalitis. If you suffer from headaches, there are some things you can try that may help. One suggestion is to keep a headache diary to help identify the source or trigger of your symptoms. Record such things as the date and time of headache onset, food choices, activities, thoughts and stress factors leading up to the headache duration, and what you did to make it stop. As you see patterns developing, try modifying your environment or habits to avoid future headaches. Tension headaches may be alleviated through relaxation techniques, a massage, or heat applied to the back of the upper neck. They also respond well to acetaminophen, aspirin, or ibuprofen. However, because of the risk of Ray's syndrome, do not give aspirin to children. Migraine headaches may respond to aspirin, naproxen, or combination migraine medications. If over-the-counter remedies do not control your pain, you may want to talk to your doctor about possible prescription medications. Some medications can also prevent headaches before they occur. When taking headaches medications, you should be aware of something called rebound. Rebound headaches are caused when you use pain medications too often, resulting in headaches that return for increasingly longer periods of time, despite taking more medicine. If you think this may be happening, you should talk to your healthcare provider. When you experience a headache, there are certain symptoms you should take very seriously. If you cannot see your healthcare provider immediately, go to the emergency room or call 911 if your headache comes on suddenly and is explosive or violent. You would describe your headache as your worst ever, even if you are prone to headaches. Your headache is associated with slurred speech, change in vision, problems moving your arms or legs, loss of balance, confusion, or memory loss. Your headache gets progressively worse over a 24-hour period. Your headache is accompanied by fever, stiff neck, nausea, and vomiting. Your headache occurs with a head injury. Your headache is severe and localized to one eye with redness in that eye. Or you are over age 50 and your headaches just began, especially with impaired vision and pain while chewing. There are other symptoms that, while not considered an emergency, indicate you should see your healthcare provider soon. They include headaches that wake you up from sleep, a headache that lasts more than a few days, headaches that are worse in the morning, a change in headache pattern or intensity, frequent headaches without a known cause. If your headaches prompt a visit to your healthcare provider, he or she will obtain your medical history and will perform an examination of your head, eyes, ears, nose, throat, neck, and nervous system. The diagnosis is usually based on your history of symptoms. Some diagnostic tests may be required as well. After determining the source of your headaches, your doctor may prescribe any appropriate medications. As in any health issue, an ounce of prevention is worth a pound of cure. The following healthy habits can lessen stress and reduce your chance of getting headaches. Exercising regularly, getting adequate sleep, eating a healthy diet, stretching your neck and upper body, especially if your work involves typing or using a computer, learning proper posture, quitting smoking, learning to relax using deep breathing or other techniques. While some headaches may be a normal part of life, they are not to be ignored. On one hand, they may be a symptom of a more serious condition that requires treatment. On the other hand, you may discover how their frequency and intensity can be greatly reduced.